Hello everyone, welcome to another series in the Academy of Online Radiology Education. My name is Ricky Olmstead. I'm a radiology resident at the Baylor College of Medicine in Houston, Texas. This month we've curated some interesting literature in abdominal radiology. I was helped out by Dr. Alice Fung, a body imager at Oregon Health and Science University, and Dr. Vincent Melnick from Washington University in St. Louis. First, we'll review an article from AJR that evaluates the diagnostic utility of CT and fluoroscopic esophagograms for suspected esophageal perforations in the emergency department. The study looked at 103 patients who presented over 17 years to the Beth Israel Deaconess Emergency Room with concern for esophageal perforation. Of these, 9 were actually found to have a perforation, so 9 patients over 17 years at a large tertiary care center shows just how uncommon esophageal perforation is. Fluoroscopic esophagograms are often considered the imaging modality of choice, but has limitations such as requiring appropriate staff which may be limited overnight, and studies may be limited by a patient's inability to follow instructions. CT is much more easily accessible and avoids most of the fluoroscopic limitations, which often make CT the initial study of choice in patients with suspected perforation. The article had a small sample size of 9 positive patients, but CT demonstrated a 100% sensitivity and 100% negative predictive value for perforation. Fluoroscopic esophagograms were 78% sensitive and almost had an NPV close to 100% as well. These findings suggest CT is more sensitive than an esophagram, and if a patient has a negative CT, fluoroscopy is unlikely to demonstrate perforation. Next, a journal article from the European Journal of Radiology, which reviews one of the most common worldwide surgical emergencies, acute appendicitis. Appendicitis has a variety of presentations and complications. It is important for the radiologist to be aware of the different manifestations of acute appendicitis. Imaging plays an important role in diagnosis, with the authors referencing a study that demonstrated out of all patients taken to the operating room with imaging findings of acute appendicitis, only 3% of appendixes were normal. The study discusses the radiologic findings in appendicitis and discusses some of the complications, which include perforation, abscess, small bowel obstruction, and pylophlebitis. This next article is published in AJR and is a little different than the rest of the articles, which look at abdominal pathology. This article by Kramer et al. From Thomas Jefferson University gives a look into the trends of abdominal imaging over the 12-year period ending in 2016. Overall, the authors found abdominal imaging has decreased from 558 to 442 studies per 1,000 Medicare beneficiaries, but it's not quite that simple. Prior to 2011, if a CT of the abdomen and pelvis was ordered, it was billed as 2 separate studies. With the introduction of code bundling in 2011, this was now billed as 1 study. So if you break up the data into before and after code bundling, there was an increase from 2004 to 2010, which then decreased after code bundling. The article looks at which studies were utilized more frequently over this time period. CT, CTA, and MRI were more frequently utilized, and the article mentions that plain radiography rates decreased the most, with fluoroscopy and nuclear medicine exams also decreasing. This next article is a review from MD Anderson, which takes a look at the lesser sac and foramen of Winslow. The article starts by discussing the embryology, arising from the rotation of the stomach in the 4th week of gestation. The article then details the anatomy and boundaries. The lesser sac is a potential space bordered by several different abdominal organs. The article splits pathology up into 3 categories: fluid collections, space-occupying masses, and internal hernias. Acute parapancreatic fluid collections are the most common fluid collection, metastases are the most common mass, and herniation of the small bowel can occur through the foramen of Winslow. This next article is by a multi-institutional group and is published in AJR. It reviews the different multiple endocrine neoplasia syndromes and the abdominal manifestations of each. MEN1 is characterized by pituitary, parathyroid, and pancreatic tumors. Up to 80% of patients with MEN1 will have a pancreatic neuroendocrine tumor. The article breaks down the different types of pancreatic neuroendocrine tumors and their imaging characteristics. MEN2A is characterized by an increased incidence of medullary thyroid cancer, parathyroid tumors, and pheochromocytomas. MEN2B is similar to 2A, but distinguished by a lack of parathyroid hyperplasia and the presence of non-endocrine features, such as a marfanoid habitus and mucosal neuromas. Radiologic findings may correlate with expected sequelae of hormone oversecretion, such as decreased bone density, nephrolithiasis, and peptic ulcers. The next study is published in the European Journal of Radiology by a group from Spain looking at pancreatic necrosis volume in patients with acute pancreatitis. There are several scales that evaluate morbidity and mortality of patients with acute pancreatitis. A few radiologic scales have also been developed but may be unreliable. These authors evaluated pancreatic necrosis volume and found it to have a statistically significant association with hospital length of stay, organ failure, ICU admission, and need for surgical or percutaneous intervention in patients with acute pancreatitis. The article found a necrosis volume of 75 cc's to be 100% sensitive and almost 80% specific in predicting complications of acute pancreatitis. This next article was published in the European Journal of Radiology and was submitted by a team from the University of Miami and looks at penetrating trauma. The article starts by stating trauma is the leading cause of death in people under the age of 44. Blunt trauma makes up the majority of trauma, but penetrating trauma is not an insignificant amount. The article splits penetrating trauma into ballistic, for example gunshots, and non-ballistic, such as stab wounds. The article does a good job explaining the science of ballistics and the expected injury patterns. The article then looks at the different types of trauma that can be seen in the abdomen and uses the widely accepted American Association for the Surgery of Trauma, AAST, classification of traumatic injuries of all the intra-abdominal organs. This next retrospective study was published in the European Journal of Radiology and looks at the use of radiomic data to predict the risk of hepatic encephalopathy in patients with hepatitis B-related cirrhosis. The article introduces radiomics as using imaging features to extract data into advanced algorithms in an attempt to characterize cellular features and clinical data. The article discusses the epidemiology of hepatitis B with approximately 260 million worldwide carriers. Of those, up to 20% will develop chronic hepatitis, and these patients are at a higher risk for cirrhosis. There are many well-known complications of cirrhosis. One of the more severe complications is hepatic encephalopathy, which is a poor prognostic sign and has a negative impact on quality of life. The authors developed a model using imaging data such as liver shape, orientation, convexity, coarseness, ascites, and other advanced features which were extracted by a software system. This model was found to be 93% accurate in predicting which patients would have hepatic encephalopathy, which demonstrates yet another possibility in the rapidly evolving field of radiomics. These next two articles are topical and have to do with the coronavirus pandemic of 2020. First, an article published in the Journal of Abdominal Radiology looks at abdominopelvic findings in patients with COVID. We know that the coronavirus typically manifests with respiratory symptoms. However, findings on an abdominopelvic CT may be the first sign. The lung bases are typically imaged in a routine CT of the abdomen and pelvis, and the pulmonary opacities associated with COVID may be seen. In the abdomen and pelvis, the most common finding was mural thickening of the colon. This may be secondary to the diarrhea that has been reported in COVID patients. Other imaging findings include gallbladder distension, nonspecific renal stranding, and bladder wall thickening. The authors looked at 141 patients who had a CT of the abdomen and pelvis within 2 weeks of their COVID diagnosis. Of these patients, 57% had positive findings in their CT scans. The authors acknowledge their study is limited, and the abdominal findings may be due to chronic disease or may be unrelated to COVID-19, and state that more studies are needed. Lastly, we have an article published in JACR by a group from the country of Colombia examining how patients have been presenting with appendicitis during the coronavirus pandemic. The study begins by noting a trend of fewer patients presenting to emergency departments during coronavirus, a trend supported by other studies that have been published. When specifically looking at appendicitis, the authors have noted a trend of fewer patients presenting with symptoms concerning for appendicitis, but the patients that do present have more advanced presentations. The authors performed a retrospective study looking at the same 3-month period from March to May 2019 before the pandemic and compared to March to May 2020 during the pandemic. In the 2019 period, 141 CT scans were ordered to evaluate for possible appendicitis, with 30% positive cases. In the 2020 period, only 55 scans were ordered, but 46% were positive, a statistically significant increase. The authors also looked at the state of presentation, developing a 5-point scale to rate severity from probable appendicitis to complicated ruptured appendicitis. The intrapandemic period found a significant increase in the proportion of severe cases when compared to before the pandemic. The authors state that they believe these changes were due to their home country of Colombia issuing a mandatory stay-at-home order. For more details, you can read our blog, where you can find links to the original publications. Please feel free to share your thoughts and questions on our forum. I'll see you next month.